Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers. You've heard about Medicare. How about MediKids? Senator Andy Kim from New Jersey has proposed legislation to guarantee every child health care in the U.S. up to age 26 through the Medicaid program. He joins Dr. Josh Sharfstein to talk about his concerns about children's access to care, the advantages of building on Medicaid, and his strategy for moving the bill through Congress. Let's listen.
Senator Andy Kim, thank you so much for joining me today on Public Health on Call. How is today going for you?
So far, so good. So thanks so much for having me on.
Well, I'm really excited for this conversation. I'm a pediatrician, and you have a major piece of legislation that you introduced called the MediKids Act. Before we get into the details of the law, could you tell me why you started thinking about the need to strengthen health insurance for children in the United States?
Yeah, absolutely. I mean, look, I'm not somebody ever thought that I'd be in politics. I ran for Congress because in 2017, my younger son was born, and he was born with some health issues, some growth challenges that he faced right out of the gate. In fact, even before he was born. And it was around that time that my congressman in New Jersey was leading the effort to gut the Affordable Care Act, and in particular, gut pre-existing condition protections. And that connection there was just really what prompted me to run for Congress. I was so worried and frankly upset that my own congressman was taking these types of steps that would potentially affect my kids and others with pre-existing conditions. Setting up children for success, being able to ensure that they get everything that they need as their bodies are growing, as their minds are developing. It's so critical. And that's really what prompted me to focus on healthcare, especially about kids. But it wasn't until I came into Congress that I realized that there are 4.4 million kids in this country that don't have health insurance, over 23 million kids that are underinsured, which means their insurance is not meeting their needs. And I just find that to be unacceptable from just a standpoint, let alone the richest, most powerful country in the world.
And I'm sure you've heard some of their stories.
Absolutely. I've heard so many more parents coming to me, really, coming to town halls, telling me that they've never done this before. They've never come to town halls. They've never come to congressional offices, but they are just so worried about the care for their kids, whether or not they're going to lose care, whether or not their kids' care is going to be cut, especially parents with kids with disabilities. I've heard from parents that are saying like they're terrified about the prospects of losing their job in this, tough economy right now. And the first thing that they say is because they worry about losing health care for their kids.
Sorry, a lot of people ask me why I became a pediatrician, and my answer is the special relationship you get to have with parents.
Yeah, I can really think of nothing more important, obviously, for parents than just thinking about how to be able to ensure that their kids are going to be okay. And just the anxiety and the fear that parents are feeling right now, it doesn't have to be this way. And I just think, especially for kids, for all the arguments that I hear on Capitol Hill about Medicaid and other things like that, I have colleagues that say, oh, well, what about people? They need to be working. And I'm like, well, first of all, a lot of those on Medicaid are working. There's a lot of other issues that people are facing, but especially when it comes to kids, they're kids, they're not building careers, they're growing, their development. They should not be held for any responsibility of the decisions made in their family or where they were born or their circumstances. They're kids. So that's really just kind of the way in which I envision this is what can we do to get that number from 4.4 million uninsured kids down to zero? And how do we do this in a way that is actually implementable, not just some, magic wand, hopeful thinking? I really want to try to design something that works.
So tell me about how this bill works. What would happen? Obviously, MediKids sounds a little bit like Medicare, but tell me, what's the thinking?
Yeah, well, look, I wanted it something that could stick in people's minds and have this idea that, look, we do have guaranteed healthcare in this country for those that are 65 and older. And in the same way that we have that towards the end of your life, I wanted to have people understand sort of a bookend, that this idea of MediKids is that you will have automatic enrollment upon birth. Every child in this country will be automatically enrolled in MediKids, which will be built off of the Medicaid platform. And the reason why I chose Medicaid is that Medicaid is built for kids. It is the most comprehensive approach and screening process, not just amongst government healthcare, but just really large. I've really heard from experts saying that you can't think of children as little adults. They have specific healthcare needs, especially because they're growing and they're developing.
And Medicaid does cover a lot of different kinds of services that private insurance generally doesn't cover for exactly that reason. But one of the challenges with Medicaid is that it's a shared federal state responsibility, and states are under a lot of financial pressure these days. Would your bill change that, or would
it would change that for kids. So from, as I said, from birth until 26, and the reason why we chose that, not just because that was where the Affordable Care Act drew the line and what families are used to, but also, again, I wanted something that could span the length of, again, one's body and brain development and make sure that we're ensuring them to have that stability. With MediKids, if this were to pass, not only would it be a guarantee, but it would be an effort at the federal level such that states would not, so the federal would carry all the FMAP, which means it'll carry all the costs of this. And frankly, that would be something that would free up a lot of states in terms of their budget, but also provide that guarantee, provide that sense that this will always be something that'll be there. And look, if families don't want to participate, they could opt out. But at least having that option of the automatic enrollment is what's going to ensure that every child in this country will be covered.
And you really mean every child?
Every child.
There's some limitations right now in many states on Medicaid based on immigration status and other factors. How did you come to just say every child?
Well, I said every child because, again, they're kids, and I don't want to hold something over them for decisions that they did not make. When it comes to immigration, I think of myself as I'm a son of immigrants, married to an immigrant. My parents made decisions about where our family is going to be born, where I was going to be born, made decisions about my life. We should just treat all kids as kids. If you have issues with regards to immigration or whatnot, let's engage about the parents. Let's talk through that broader concerns that we have. But when it comes to the health of a child, I can't imagine ever, to look a sick kid in the eye and being like, you can't be treated or you can't be able to get the kind of care you need from a doctor because of decisions that your parents made. I just think it's unfair.
So the MediKids Act is going to provide coverage for every child up to 26. It's going to loosen up some money for states so they could then spend for other things. It's going to have that richer benefit package that Medicaid has. I hope I don't sound terribly cynical, but it doesn't seem like the kind of thing that would fly through Congress right now in 2026. So tell me about your political strategy. How do you get people to buy into this, particularly at this difficult moment?
Yeah, no, absolutely. I've been asked that question, and I understandably, because I was kind of thinking through myself. I get it. I have my eyes wide open. I understand the challenges that are here. But as I said, I also designed something that is not meant to be a messaging bill. And this is meant to be a real implementable plan. By building off of Medicaid, this requires no new administration, no new agency, no new bureaucracy. It's something that's proven. It already covers a significant portion of children in this country already. And it's been proven to be able to work. So that's one aspect about it. It's not going to be some major overhaul that'll change healthcare for everybody. When it comes to why now? It's actually because of this division right now in our country that I decided to release this proposal. Especially as we're in the lead up to the midterm elections, it's in part because when I'm back home, or frankly anywhere in this country, what I constantly hear from people is they say, okay, we hear what you're saying you're against and what you're worried about with this administration, but what are you for? What is it that you're trying to push forward on? What's your solution? And I have to say, my solution, while I'm against the Medicaid cuts that happened, my solution isn't just to reverse the cuts, because even before Trump came back into office last year, there were over 4 million kids without health insurance. So I wanted to lay out a plan for how we can actually solve this, how we can actually put forward and recognize that this is just a matter of political will that is stopping us, not about policy decisions, that this is something that we can enact. So that's really what I wanted to do, is I want this country to be talking about this fundamental premise of, do we believe that every child in this country should have health care?
What has been the response both inside the Capitol, but also outside the Capitol?
I'll say I've been getting a great response because, again, I think a lot of people were yearning for that kind of discussion about, like, what next? And here in this building, I often say I work in the most reactionary building in America. We're constantly every day reacting to just whatever in the headlines or whatever tweet is coming out of the White House. But this gives us a chance to actually kind of just think through and have a vision, which is actually what the Constitution, what Article 1 actually intended for Congress to have, with that we would lay out the vision and the executive branch would execute it. So I've had great response from a lot of my colleagues. And look, even amongst the Republicans, while they certainly have their concerns about just a future of healthcare at large, the general premise about kids is one that cuts through. And as someone who has a 9-year-old and a 10-year-old, there are not too many of us in the Senate that are parents of young kids. So I can talk about this in a very personal way about the anxieties that I feel as a parent. When I talk about the broader public, what I'll say is I've been blown away by the energy and the excitement. I know there's a lot of crazy things happening in the world right now, and most things get maybe, 6 hours of news attention at a given moment. But the fact that there's been so much chatter and talk about MediKids is exactly what I wanted. And I think it has really reinvigorated this discussion in America about guaranteed care, about, what our role is to be able to provide. And that's exactly what I want. And I hope that, first of all, I've been seeing candidates talking about MediKids on the campaign trail. So, that's really heartening that they are talking about what we're for, not just what we're against. I hope that it generates more discussion as we get to the midterms. I hope that the next Congress will hopefully have leadership and gavels in the hands of people that will seriously consider MediKids as a core element of what the Democratic Party wants to do going forward. And I hope presidential candidates and others, I've already talked to some that are considering running, and I hope that others are excited about this idea of showing the American people a real tangible way that we can make a huge impact, not just on healthcare, but also on affordability issues for families that are struggling right now.
Where do you think there might be organized opposition to a bill like this?
As you said, there'll be people that'll question just who all is encapsulated within this, whether it's by immigration or by wealth. But as I was saying, look, this isn't just meant to close the gap with the 4.4 million kids without insurance. A lot of times when it comes to wealthier people, for instance, they may very well have employer-based healthcare, for instance. Oftentimes, kids are kind of just like an add-on to that. It is not designed specifically for them. So even for families that have some means, families that have employer-based care, I still think that this is the better effort for their kids, because it's going to, for instance, provide universal mental health coverage at a time when mental health coverage for kids is challenging. It's difficult. And of course, we need to be thinking about, the providers for kids, pediatricians, mental health providers, pediatric dentists, and others. So, that's something we need to boost up. But, as I mentioned, dental coverage for kids, that's, even worse in numbers in terms of the number of kids without care. Vision coverage for kids is already also something that many lack. So I just think that this is the best system, not just to close the gap, but I say to raise the bar for all kids.
Senator Andy Kim, thank you so much for taking time from your very busy schedule to talk through MediKids and all your work to expand access to health insurance.
Yeah, thank you for shining a light on this and for all that you're doing on not just MediKids, but all of health. I really appreciate it, and thanks for letting me be on the show.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.